cost of living pressures, a continuing pandemic, housing shortages, lots of challenges piling up, add in the challenges of home, of work. And, there's, for some people across the country, there have been cause for mental health issues here, that they've really felt something that they haven't previously. There are services which offer to support people who are struggling, and Mind Australia is one of them. Brett Williams is the General Manager in South Australia for Mind Australia. Brett, good morning.
Good morning, Matt. How are you?
Good, thanks. So how long has Mind Australia been around?
Mind Australia has been around for about 44 years. It started in Victoria. Originally was called the Richmond Fellowship of Victoria and changed its name about 10 years ago to Mind Australia. And we've been providing supports in South Australia for about 17 years.
Wow. Okay. So a good history there. So you'd be able to track, trends and things like that. So, for example, potentially seeing an increase in support needed by people over the past 2-3 years or so?
Most definitely, yes. Some of our programs have a pretty open referral process, so we get self-referrals and referrals from GPs, etc. So we do see an increase in people seeking our support.
Has that happened over the past couple of years?
Yes. Some of it has been around some of our programs around helping people to transition to the NDIS, but so a lot of people try to see whether they meet the criteria for that. But just generally, yeah, as you said in your intro, there's a lot of stuff going on at the moment that puts a lot of pressure onto people, and we do see, an increase in levels of distress and people seeking support.
Mm-hmm. So for these, the kinds of challenges that people are facing at the moment, how do you go about providing support for someone?
Well, we do it in a number of ways. So we've got a couple of programs in the Riverland. A couple of them are funded by Country SA, PHN, the Primary Health Network, and those are the ones that have got the open referral. So what we do is we work with people on things that they feel that they need to address. So we have what's called our My Better Life plan, which looks at a whole range of different domains in people's lives and identifies areas in there that they would like to set goals and work on. And then they have a dedicated worker who provides them with support and mentoring to reach those goals. And a lot of our workers in the Riverland and elsewhere have actually got their own lived experience of mental illness, so they really understand what people are going through and are able to really connect with them and help them.
Okay. Brett Williams is the General Manager in South Australia for Mind Australia. So you've actually got services available in the Riverland itself.
Yeah, so we have 3 services available in the Riverland. So the 2 that are funded by the Country SA PHN are Country Wellness Connections, which is, as I say, an open referral. So you can ring our 1300 number to make a self-referral, or a GP or a family member can refer you through. And then we look whether you meet the criteria, and then we start to work with you. The other service that they provide that's funded through the PHN is a new one called the Service Navigation. So that helps people that have got some reasonably complex needs over and above just mental health, who might need to connect with other services, which can be quite difficult for people. So that service helps them to connect with other services in the Riverland, and part of that is working with other providers to make sure we've got really clear pathways for people to find their way to the service that they need. And another aspect of that program is that it does help people to test their eligibility for the NDIS. Okay. We also have one other program that's funded via SA Health, which is called Individual Psychosocial Recovery Packages. So that service, there is a closed referral for that, so you need to be connected to one of the community mental health teams. So you've had some sort of event where you've needed support from the public mental health service, and then they will refer you through to us to give you some ongoing support in the community.
Yeah, it's good to hear that you are providing these services in a regional area, because quite often we hear of regional areas missing out, particularly in terms of mental health services that are around.
Yes, and that's very true. And if you look at the case of the NDIS, it is very difficult for people with psychosocial disability to get onto the NDIS to find good providers in those rural areas. But we are seeing, a bigger commitment from the various funders to provide services in those rural and regional areas. And Mine are lucky enough that we have the privilege of being able to provide that to the people in the Riverland.
Brett, really appreciate your time this morning. Thanks for telling us about it.